Yeah,
concerning
we
COVID?
do. Yeah, we do. We do. We have a couple of news. As always, if you are my patients, stay after if you have anything personal, health related. And exactly what Jennifer said, resiliency and well-being. That's all we have to concentrate on things we can control. There's this famous statement, which I always butcher that one. Something like, God give me a wisdom to understand things I cannot control only things that I can control, and have a wisdom of separating between the two, or something like that. You know what I'm saying? So, COVID news. Some news are good, some news are not so good. Let's start with good news. Good news is that there's no uptick. In fact, there is a downturn, which is sort of weird. I think last year, exactly this time, we started to have a gradual increase. Yes, thank you. Serenity prayer. I gotta put that somewhere on my desktop so I don't have to keep not remembering this. So numbers going down. I think East Coast is doing even better. So it's about 5% positive presence right now in different parts of on our side. It's a little higher on the West Coast, but I think it's still in single digits, which is exciting. There is uptick, significant uptick in other standard fall and winter common colds. Most of those are various viruses, like adenovirus, for example, is one most common one. I'm sure you all have seen somebody close to you getting something, and it's not a COVID, so do stay aware of that. I would say that if your symptoms are of a common cold, don't bother wasting COVID tests. So if you have a low-grade fever and just upper respiratory symptoms, maybe runny nose or a little bit of cough, I wouldn't run tests necessarily, because probably it's just a cold. But if you have a kind of sore throat, achiness, high-grade fever, those are much more likely being flu or COVID. So those are the symptoms you want to run the test for. Obviously, if you're positive, employ everything we've talked about. So that's one positive note. Not so positive note. So it turns out that, first of all, there's some potential that this is coming from UK, and I don't have time right now to find that study. I found it and I lost it. There are two studies that are important. So the first one from UK is saying that it looks like that the new variant, the Stratus, seem to have a higher chances of long COVID after it. And the second is, it looks like that the people who have more than one COVID back to back within 12 months tend to have a dramatically, basically 50% higher rate of having long COVID. And if that happens, basically your chances of long COVID after a second COVID within the year go more than 25%, which is kind of scary. Think about this. And as we learn that long COVID is actually pretty bad disease, all in all things considering, I'm getting increasingly more concerned about kind of a long-term consequences here. We are heading towards pretty much large proportion of world population continuously suffering from some of the long COVID symptoms, and there is no clear solution in sight. So I may need to start, with Ashley's help, of course, spend a whole lot more time researching different pathways of care, because we have a comprehensive ideas of treatment, but we don't really have simple solutions. That's the problem. Often many illnesses would have a first line, which is pretty straightforward. If you have a high blood pressure and your lifestyle didn't work, you take one pill and that typically controls blood pressure. We don't have that for long COVID. There's really no simple treatment. Many patients end up getting multiple different supplements and some medications like low dose naltrexone and et cetera, et cetera. So, long story short, I'm afraid that we have to be very, very vigilant here. The boosters, if you're qualified, get them. Well, if you feel like you can tolerate them, also obviously, if you're very concerned about allergic reactions. But there is no data that boosters increase long COVID consequences. There are some occasional post booster side effects that appear to be like long COVID, I'm going to acknowledge that definitely exists, but the frequency of those is way, way lower. So definitely boosters make sense. If for whatever reason you choose not to get a booster, it's actually a good idea to start masking and also to use that nasal azolastine, this nasal spray we talked about last time. It's over the counter. You don't need a prescription. You can just, if you're traveling, you can spray it every couple hours. It's a basically antihistamine spray. It seems to be working, especially if you're a nose breather. If you're a mouth breather, probably won't work. But if you're a nose breather, by all means, it definitely consider using that when you're traveling. Or when your risk is high, like you're going into some kind of gathering, you're afraid, etc. So yeah, the weather has been amazing. Maybe that's, as Randall says, maybe that's the reason because we are outside a lot more than we would typically be in the mid to late October. How long this amazing weather will last, I'm not sure. So um, I can't really do everything at once. So those of you asking me questions for typing and all that, this has to wait until I get off of a conversation, and I'll try to post things as I see able to. Okay, so that's my COVID updates. I have not evaluated the study that claims doubling of the risk of long COVID after a second COVID infection starting last year. I have to evaluate the data myself to make a conclusion whether it is or it isn't, but you can just, this is from general media. It's in multiple media outlets covered. So if you want to read this in more detail, by all means. So that is one news. Okay, so a couple other news. So if you're local, I hope we will see you at AIM and NAS partnering, National Academies of Sciences partnering, on October 30th. We're going to have a very big event. It's continuation of Fred and I doing Beating Heart online. Unfortunately, this event is only in person, but, and I'm not supposed to tell you that, but we're all, it's okay to, I think, to say. But if you register for it, actually you can, there will be a recording. So if you register, you can literally just come back to it, to the recording later. So I'm going to give you a link in a second for that because that is on my screen and easy to do. So I'm putting it, it's from 6 to, I think from 6 to 8:30. It's going to be in the main building. If you have never been to NAS building, I strongly recommend you do, because the building is gorgeous. There's an arts inside. It's a wonderful, the program is completely free. Fred is absolutely amazing. I'm sure he's going to be doing music. And there's also another really interesting speaker. So her name is, so I don't butcher it, Moira. I think that's how I say it, McGuire. And she's a retired nurse and officer in US Public Health. So she's been basically chief of integrative health and wellness in Walter Reed for many, many years. So I think we're going to have a wonderful conversation. She's been in this intersection between health and spirituality and also patient care for longer than me. So I'm actually probably going to be the youngest there. And that's promised to be quite an exciting conversation. So I hope to see you there. So I wanted to make sure that I give you this update. So the other couple of things that I wanted to mention is people are continuously asking me about not just which boosters to get, but what's the prep. So again, right now it's the right time to get COVID and flu. Those are the two big ones. If you have a chronic lung disease, whether it's an asthma or COPD, or you've had some kind of lung, like, I don't know, maybe you had a lung cancer and they had to take a part of the lung, or anything that impacts your lung capacity, that is, do get RSV vaccine. If you don't have any lung problems, I actually do not recommend RSV vaccine. What am I basing this on? Just a precaution, because the traditionally the initial trials always end up looking better than real life practice. And in an initial trials on RSV, yes, there was a substantial reduction, but if you carefully digest that information and you look into that study, the real reduction was in people who either were really frail and really old or had existing lung disease. 65 healthy-year-old person had almost no drop in mortality from RSV shot. And that's what I'm basing it on. I don't believe that RSV in a healthy 65, 75-year-old person is going to be as deadly as what they describe. In fact, the data is pretty clear. It's not any worse than flu, and it's probably even lower than a flu. In fact, if you carefully look at overall statistics, flu last year killed way more people than RSV, something like 2-to-1 ratio. Anybody who's on a chat GPT or a computer right now, just Google it and give us the real numbers. I'd love to see how many people died last year, flu versus COVID versus RSV. It's 30-second lookup if somebody is. I know Stephanie is fast at that. Steph, if you have a sec, just chat GPT this. It's pretty accurate usually to give us exact numbers. It's actually good information to have at the fingertips. I just don't remember these facts all the time. They kind of, if I can look up something, I usually just not remembering this because I know I can look it up. But I will tell you that the RSV is not the top. In fact, the flu generally is highest. Now, obviously, years before it was all COVID once it started. But COVID is now being sort of weaning off gradually, and flu just stays the same. Problem with flu is weakens the immune system and weakens the whole resources typically so much that people often die from secondary infections, secondary bacterial infections. With RSV, that happens primarily to people who have bad lungs because RSV is heaviest hit on the lungs. If you're otherwise healthy, the RSV is just going to feel like regular bronchitis. You're not even going to know it's RSV. Literally, you're going to think it's some other virus, not. And there's so many viruses that can cause prolonged coughing, aka bronchitis. So those are some of my updates. The prep, we've shared the prep that I like. I'm hearing more and more positive feedback on the prep. Of course, you're doing this on your own accord. This prep that we came up with, there is really no scientific research on the prep, except to say that, of course, it makes sense to take something that lowers histamine, and we have a lot of evidence that things like vitamin C, stinging nettle, quercetin, all of those good things are effective at lowering histaminergic flood. And generally for COVID shots, the antihistamine medication is not recommended. There's been some idea that it actually changes the immune response and weakens the vaccine effectiveness. So don't take typical antihistamines, but I wouldn't expect the same effect from the prep that I gave everybody from natural dehisce in combination with 3 homeopathics. Thank you. All right, let's see what Steph posted. Just curious, how bad? Yeah, so this is great. Thanks, Steph. So you can see that flu is always ends up being very high in the winter. You can see that it's basically, yes, COVID has been leading, but flu in the last, which year is this? Oh, so this is 20. Okay, so you can see that the flu last year has been pretty much as high as COVID in this. In fact, it's been way higher than COVID. So let me show this to everybody. This is a great little chart to review. Sorry about if you're seeing only part of the screen, but this is the table. So you see different thickness of the line. So the very faint line right here, that's 2023, stronger, stronger. So let's look. This is the last year's flu. So in the peak right here, it was basically causing 10 hospitalizations for 100,000 people. And that was comparable to the flu season 2 years before that, right? So 2022 to 2023, right here, almost the same number. And the flu is always tops the RSV. So wherever you look, RSV is this yellow line. It's a big difference. I mean, we're talking about, let's look at the last year. So last year, if you look at this thick line, looks like RSV tapped out at under 5. So this is more than a twofold difference here. That's why RSV concerns me a lot less than even the flu. And of course, flu vaccines are the old vaccines. So those seem to be a lot safer. So by all means, I've always advocate for those. And then if you look at the COVID from the same period, there would be this thick purple line right here. So actually, funny enough, last year, it looks like RSV and flu were identical in terms of frequency of hospitalization, which is somewhere right here. I guess that's, let's say, 3 out of 10, 100,000 patients. That's why I've never seen no one under my watch last year in my patients got hospitalized with any of these conditions because I don't have 100,000 patients. I don't even have 10,000 patients. So that's why it statistically speaking makes perfect sense that I wouldn't see anybody because I just have less patients total because this is per 100,000 patients. Now, that's not a mortality, but you can extrapolate. Mortality obviously would be some proportion of hospitalized patients. I don't know what that proportion is. Maybe the data is here somewhere, but I'm gonna. Thanks, Steph. This is super. I love how you come up with this stuff on the fly like this. I haven't even seen this article. So this is from, I don't know, from Scientific American. Oh, okay. Well, that's great. We can trust this. Okay. All right. So I'm gonna stop sharing. We have about 10 minutes for Q&A. Let me go back and take a look. All right, nothing happened to this group. I think I already answered. Thanks, Isabel. Trust me, if somehow I have to leave GW because they make my life impossible, I will make sure anybody who wants to come to CIM will be able to do so one way or another, even if I have to make your visits free. I'm not kidding, because I know that that's also part of my service. So, all right. Thanks, Linda. Love you too. That's great. I try. I really try to stay positive through all this shit. I guess we were getting recorded. Oh well, it's fine. I can curse occasionally. For me, I've lived through my problem right now has something to do with my childhood trauma, right where I grew up. So I feel like I'm being forced back into the environment that I had to leave. And I'm not being political here. I'm just simply telling you how it feels. It doesn't necessarily mean that that's the reality. In fact, reality may be completely different, and in fact, we may be perfectly fine down the road, but it's just kind of very uncertainty of the times and the constant drama, I think, is how I lived the first 20 years of my life. I immigrated here because I didn't want to live like this, and I felt like I found my home here and built my family and life, and I loved it because this is a place where you can become somebody if you've never been anybody. And so then now suddenly I feel like, well, memories of that childhood trauma are coming back. So thank God I have enough support that I can work through this, and I have my own practices and my own centering exercises that I feel keeping me very positive. So. All right. UHS stands for University Health Services. It's one of the largest US healthcare corporations. They're highly for profit. And that's all I have to say about that. You can Google what's going on. And part of GW being sold to UHS, including medical faculty associates. If you're a patient at medical faculty associate and you're wondering about this, all I can tell you, I cannot disclose anything. Actually, I don't know anything anyway. So all I know is what is publicly available, and I'm comfortable talking about it because it's publicly available information. You can just pick up your computer and Google it or your phone and learn the same thing I would learn. All right. Okay, so nasal spray. Give me 1 second. I just want to make sure I give you an actual article to CNN from a couple of weeks ago, maybe. Yeah, about a month ago. So actually, I'm gonna give you an study itself. I think that'll be better. So the spray called, let me spell it. So spray called azalestine, and I just needed to figure out the spelling because I'm not a best speller, but I'm also gonna give you actual link to paper, so feel free to look it up. So this is an actual JAMA article. So here I'm posting it now. So feel free to take a look. Because it's available over the counter, I actually don't know what it costs. If you have Medicaid, it may even be covered for you. So you may want to ask if you're my patient. I'm happy to write it for you. I have zero concerns. Nasal antihistamine nasal sprays, their only side effects are kind of a dryness that can sometimes be caused by the spray. Beyond that, I don't really think there are any serious side effects. This is an old antihistamine, old style. So yeah. Oh, thanks, Steph. So Steph posted the actual name of what's over the counter. Astapro, I guess is. There are probably others, I presume. I'm sure that every chain like CVS will start making their own right away because there's going to be a demand. So keep an eye on that. If it's over the counter, I presume it's going to be not expensive. And I would only use it prophylactically when you're exposed. So when you're in a group, big crowds, when you're traveling, etc. All right, let me go back, make sure I didn't miss anything. All right. Okay, so now Irene, we addressed that. Back to back COVID. Yeah, so yeah, Jennifer, I think the biggest concern with multiple infections is that every subsequent infection increases the risk of long COVID. Beyond that, I don't really think there's a lot of, well, I guess I shouldn't say that. I mean, we don't know. I think this is we're all living through this, right? So I was thinking to tell you probably nothing, but I don't know that. I don't think I can answer that. It's not surprising that this study just came out showing increased risk of long COVID after repeated infections. It makes perfect sense, right? You have a um, almost like a compound negative impact because we do know that each episode of COVID takes a significant beating on a cellular level. The inflammation that is generated for some weeks dramatically alters metabolism for a period of time. So if you unable to fully recover from that dampening effect on mitochondrial health, on energy production, you will potentially, every time you'll get a little bit lower energy production, leading eventually to some symptoms. So I think working on prevention is just as important as recovering as fast as possible. Right. So all of those protocols that we've been talking over the years, what to do when you get an acute COVID, and probably I should in lieu of all this, I think what I'll do is in the next week or the week after, I'll make sure we'll go over the protocol again. So that sounds okay. I think I'm doing a wellness next week, so I'll do that. I'll just come up and I'll review the whole protocol again so that you don't have to wait for, if you get COVID, then you don't have to wait for another Friday to ask me questions. So you can have that in your fingertips. Okay. I'm going to, I'm doing No King's March tomorrow. Great question. Sirius, I don't think so. You're going to be outdoors. This is a great time to use the azolastine spray. The reason I wouldn't mask necessarily is in a situation like this, especially when you're walking outside. So here's let me position this precisely. Otherwise, it's confusing. If you're going to use a surgical mask, they don't protect you much at all. Surgical masks somewhat protect other people. Your personal protection from surgical masks, yeah, but I really don't recommend people to walk a lot with a KN95 or N95. It's okay if you're sitting, it's okay if you're standing. You're going to be walking and potentially you're going to be needing more air. So restricting the airflow by so N95 and KN95 are much thicker masks. Those are the only masks that are truly protecting you. The surgical mask, the data is it's better than nothing. So if you want to wear something, that's fine. But don't get an idea in your head that this will protect you well. It will not. Surgical mask cuts the risk, I think, something like 50%, versus the K95 or N95 cuts that risk close to zero, something like tenfold down or something. I don't remember this data because we haven't reviewed that in a while since masking has not been top of the priority for quite some time. That's why I love this idea of the spray because the spray gives you more than 50, I think it's like 70% reduction in risk. So that's probably better than the surgical mask. Should you do that both? Sure. If you want to do both, of course, that's fine. If you want to do that. But don't wear N95 or KN95. You're probably going to get short of breath. And unless you not, maybe you have such a great lung capacity that you're able to draw the air through the mask. But make sure you try it out first. And then if you want to wear a mask, sure. If that's comfortable, why not? All right. All right. Great question. Thanks for that. Okay. Protocol is there for vaccines. Okay. Right. And so Eliza next week is going to be doing mind body. In particular, she's going to be talking about spirituality, which is quite exciting topic, and how that incorporates into our medical care. So we're at the half an hour. Look at that. How precise is it? So unless there's one or two more questions. Oh, what about K94? K94, is there such thing? I think you meant K95, right? I don't know about K94. K95 is a slight step down from N95, and that's what I use. I use K95 all the time, only because they're a little bit better, like they're more comfortable. The N95, their pressure is much higher, and I hate that. Like if I wear something on my face that's so compressing, I don't feel well about it. Rana, I think it's probably K95. It's probably their version of it's probably the same thing. So yeah, no, they're great. That's what I recommend. So and also because they're much cheaper. The big problem, N95, the medical grade, they're way more expensive. So unless you have an access to some free masks from your doctor, K94 and 95, I guess, would be my choice. Those are not expensive. Yeah. Again, test everything. Oh, the other thing, N95 has to be fitted. It's a process where you put the mask on, you spray a smell that is nauseous somewhat or really strong, like maybe a citrus smell. You shouldn't smell it because the N95 are so strong, they're going to filter out all the smells. If you smelling it, it means the mask is leaking. So you have to keep on looking for the fit that is better. N95 comes in different sizes. There's small, medium, large. Sometimes they even come in a kind of a more subspecialized sizing, which I don't even remember. But traditionally, if you're working with tuberculosis, like pulmonary doctors, for example, they supposed to get very special measurements of their masks so that they just know exactly which masks they need to carry. And so they always have a couple in their pockets so that when they go in in a room with a patient with tuberculosis, that they can wear that. That's where this information comes from care for patients with TB. But generally speaking, for the COVID, K95 is fine. That's way step down, but it's still way better than surgical mask. The difference is massive. If I remember correctly, N95 basically risk is less than 1%. KN95, you bumping your risk up to, I think, like maybe 3 to 5% in that range, versus surgical mask, something like, I think it's just 50% reduction. So you go from 100 to 50%. So that it's quite a big difference. And that's my sign. Thanks, Janet. Dr. Clausen, so great to see you. And what do you
Thanks
have
for
for us?
having me again.
Yeah.
Well, I think it was great that you brought up spirituality because I think it's timely to talk through that. I'm going to go ahead and share my screen. And maybe, Janet, if you can let me know, you should just be able to see the PowerPoint and not my notes. Does that,
That's
that looks what you're seeing? Okay, excellent. So I wanted to offer a little discussion today about spirituality, what it might mean, and how we can leverage it for this time we find ourselves in, change and uncertainty. I think everyone's feeling it on different levels and different ways. So my goal today is just to be able to offer a few practical evidence-based ways we can draw upon spirituality in our personal lives. We can also talk a little bit about our professional life, and for those who are healthcare providers, how we can bring this to our work. But whatever spirituality means to you personally, whether it's faith or purpose or connection, nature, all these elements can be a profound source of healing and strength. So Janet gave you a little bit about me, and I'll just mention, again, I'm a nurse midwife. A lot of my understanding of spirituality has grown through my clinical work. I'm also a PhD trained researcher, and I'm currently finishing up my postdoctorate with GW within their primary care research program. And I also work closely with the Resilience and Well-being Center at GW. And a lot of my research focuses on how things like early life experiences, trauma, and spirituality influence well-being. And I've researched and applied these variables to populations such as healthcare professionals, mothers and birthing folks, and their families. And I'm really interested in integrating evidence-based research, particularly with mind, body, spirit practices. There's a lot of evidence on that to foster healing, resilience, and compassionate care as a provider. And a lot of what I think gets talked about in these sessions is how important whole person care is, and that includes connecting and reaching folks through compassion, trust, and also spiritual health. And as we go through this presentation, I welcome you to connect. You'll see my email, and later on there's some QR codes with some other ways we can connect. So I wanted to offer a few definitions to just acclimate ourselves to this space. We're going to be talking about a lot of things that might feel really far out to people. It also might feel very common sense to some folk. So at GW actually houses GWISH, the center called GWISH, and it's led by the director, Christina Polkowski, who is a physician and researcher, and she's an expert in some of the most profound studies that have come out looking at spirituality care, and its effect on whole body health. She primarily focuses on those around populations in chronically ill and those towards end of life. But a lot of what she writes about, we now know, can be extended to all people and all types of care. And so Christina, Dr. Polkowski, has said before, famously, spirituality is not the part of all human beings that search, spirituality is the part of all human beings that searches for meaning, purpose, and connection to others. Recently, there was a global consensus that was developed on the definition of spirituality, which I think is important, and it's expanded the concept of spirituality to include the following. Spirituality is a dynamic and intrinsic aspect of humanity through which persons seek ultimate meaning, purpose, and transcendence, and experience relationship to self, family, others, community, society, nature, and the significant or sacred. And spirituality is expressed through beliefs, values, traditions, and practices. And most recently, Jane Goodall, she's said this and wrote about this many times, that she saw nature as a spiritual sanctuary. So lots of ways to connect with what we would call spirituality. A few other quotes that I find helpful. Spirituality can be seen in relationship with the smallest things which people do, such as the food they consume, the dress they wear, and their relationships. Spirituality is both human and divine oriented. And then for our last definition here, spirituality is part of a humanity that refers to the manner in which people grasp and express the purpose, meaning, and the way they undergo the connection with the moment, to their self, to others, to nature, and the sacred one. So why spirituality now? Why not, I would argue, but for those that need convincing, we are in a time of overwhelm and disconnection. Now more than ever, people are searching for meaning, belonging, and a sense of the sacred in everyday life. Now, also more than ever, science is validating what wisdom traditions always knew. And in the top right, you'll see just a kind of a snippet. Not so long ago, there was a call from the NIH to include spirituality into a fuller picture of research on whole person health. I think it's also important and funny, Misha, you mentioned this earlier in your discussion, that we are living through collective trauma and transition. And again, now more than ever, we're seeing this play out in real time in a way that one could argue, for all we know, we haven't really been exposed to it like this. As humans, we crave connection and meaning. And we're seeing again that healing is now becoming holistic, a part of whole body care. So let's speak a little bit about spirituality and some health outcomes. Research is consistently showing us that things like spiritual well-being correlates with better mental and physical health. We know that people who cultivate spiritual connection often report greater quality of life, emotional balance, and even improved decision-making during illness. Physiologically, spirituality and practices like meditation and prayer are linked with lower blood pressure, stronger immune function, and increased longevity overall. In chronically ill populations, we often again see spiritual well-being, and those who have higher levels of spiritual well-being reporting lower rates of pain, better adherence to care plans, better vision of what they want their health to look like. For those experiencing substance use, again, those who cite in the research higher levels of spirituality often have better outcomes. Um, my dissertation focused on spiritual well-being among birthing pregnant people, and we found that those folks who tested higher for spiritual well-being actually reported higher rates of bonding with their fetus and their baby after birth. So really powerful, and so much evidence every day coming out about the connections. We know that spirituality and spiritual practices influence both body and our behavior. So on the physical side here, we see things like reduced stress hormones, healthier cardiovascular function, and faster recovery from illness. On the behavioral side, we see more positive health behaviors, again, less substance use that I mentioned, and greater adherence to treatment plans. So really, in other words, spirituality can support both why we heal and how we live. Spirituality starts to become real through practice, with small, consistent ways of turning inward and connecting outward. So those who are not connected through a specific religious group or are not interested in that, I wanted to offer some other ways you might be able to be inspired to connect with spirituality through these practices. Most of them might sound familiar, some might be new to you. So we have meditation and mindfulness, lots and lots of evidence on it. Meditation doesn't have to be long or complicated, and it's really just training our attention. And for example, you can just take 3 mindful breaths before opening your computer, or perhaps just noticing your breath and kind of that space in between. You might decide to do and implement kind of a 5-minute body scan before bed, just noticing sensations without judgment. And studies have shown that even just short daily practices like these can lower our cortisol, can calm the nervous system, and improve our emotional regulation. Prayer or chanting or perhaps mantra recitation can be a source of rhythm and grounding. And again, these are all not new. These are ancient practices. For some, this might mean reciting traditional prayers. For others, it may be a simple phrase like, "May I be at peace. May others be at peace and free of pain." In many cultures, just the sound itself is seen as sacred. So you might hum or whisper or repeat a mantra with your breath. And simple ones can just be, "I am here, I am in my body," or "thank you," or "let go." And these repetitions of words and sound regulates breath, it slows our heart rate and creates a sense of surrender and comfort. And journaling, of course, is a great reflective practice that can help transform experience into understanding. Some folks like to keep a gratitude journal or a list at the end of the day, asking themselves questions like, what's giving me strength right now? Or what am I learning from this transition? Writing by hand can be really powerful. And it might be a dying art, but I encourage it because it engages different parts of our brain and it helps us integrate emotion, cognition, and meaning. A few more. So reading, of course, contemplation. This is some of the one of the oldest spiritual practices. It could be sacred text, it can be poetry, or simply just something that's really opens your heart. For example, beginning the opening of your day, the beginning of your day with a passage or quote, and just sitting for a few minutes and reflecting. And this practice fosters perspective and invites wisdom to our everyday. Rituals or symbolic acts can be really important. Rituals help us mark transition and create sacred moments within ordinary time. So you might light a candle before starting your workday, or take a mindful walk after a difficult conversation, symbolically as a way to leave the stress behind, or even a cup of tea taken in silence can become a ritual for folks of grounding and renewal. And rituals work because they give us structure and meaning to change. And with that, you might have ancestral wisdom traditions that have been passed down, and these become really grounding points in times of chaos and uncertainty. So I encourage you to explore that and to research perhaps something that might feel that's calling to you. Service or altruism, these acts of service, whether big or small, these are one of the most strongest predictors of well-being. And this can look like volunteering at a community event, or checking in with a neighbor, or mentoring someone new at work. The key to all this is the intention behind it. And because when we help others from a place of compassion, rather than obligation, we reinforce our own sense of purpose and connection. And this can be really powerful for people. And lastly, but again, remember there are many ways to connect with spirituality. Movement and dance can be very powerful. It brings spirituality into the body, and there's a lot of really interesting evidence coming up on movement. You might have heard things like somatic dance, things like that are becoming really popular, particularly with younger generations, but really can be appropriate for all ages. And example like this might be stretching gently every morning as a way of saying yes to life, take mindful walks in nature, of course. And we know that in many traditions, dance is prayer and motion. So it's a way to release what's heavy, to feel joy and connect to something larger through rhythm and flow. So much now is coming out about the power of energy and the presence of energy, and movement is shaking up that stagnant energy and inviting opportunity for growth and transformation. And the body becomes the temple through which spirit is expressed. I love that quote. So, if you're interested in learning more about spirituality, particularly the research that's coming out, I just wanted to offer a few examples of this. So, we have the GW Institute for Spirituality and Health, which I mentioned, GWISH. That's going to be really helpful for those who are caring for others and healthcare providers. The Institute for Spirituality and Health is really great. They offer a lot of amazing events, and they're always putting out some interesting publications. Harvard has the Human Flourishing program. And in DC, there's the Mind Body Medicine Institute, which is really fascinating. They offer really powerful trainings that anyone can engage in, and is a great resource for those who are local in the area. I put up a QR code in case you're interested in looking at some readings. This Spirituality in Practice, it's spiritualityinpractice.com, has a lot of really great offerings. It is interfaith based, so not any specific religion. It's really focusing broadly on spirituality, and they have a great book list. They have quotes that can get sent to your mailbox every day if you're looking for just something small. They have movies and online courses, and I've really enjoyed a lot of their free offerings. And so that might be a fun place to start if you're not sure. And so as we wrap up here, I just want to invite any questions or comments. This link, this QR code is just another way to contact me. If anyone's interested, they can come off their mic and just ask if there's any questions. Or you can put it in the chat, but I don't know that I can see the chat.
You can now unmute yourself.
Yeah, I'm also unmuted. Yeah, if you need to ask Michelle something in person, just raise your hand. We'll make sure we ask you to unmute yourself.
And while that's, just give a moment, I'm just going to switch off because we're going to do a quick meditation to kind of just soak in what we've talked about today. Great. So why don't we take a few breaths and transition to a meditation. And I'm going to get comfortable. And so this meditation is going to be focused on connecting with spirituality, whatever really that means for you. So take a moment and get comfortable. You might let your eyes just kind of close right now or soften your gaze. If you're sitting, feel your body supported by the chair or the floor beneath you. And notice where your body meets support. And at your feet, your seat, and your back. And let's start by taking a few slow breaths in through your nose and out through your mouth. And with each exhale, allow yourself to settle in a little bit more into this divine present moment. I invite you to let go of the day so far and any plans that you have ahead. This time is simply for you to pause, to breathe, and to reconnect. Let's take a few breaths in and out. And as we bring awareness to our breath, notice its rhythm. There's no need to change it, just to observe. And feel the rise and fall of your chest and the gentle expansion of your belly. Imagine that with every inhale, you're drawing in calm. And with every exhale, you're releasing what is heavy and what is unnecessary.
Heading.
You might silently say,
Basil and the take off.
breathing in, I arrive, and breathing out, I let go. Now slowly scan through the body from the top of your head down to your shoulders, down to your arms, your hands, your torso, down through your legs, and then your feet. Wherever you find tension, breathe gently into that place and soften.
Saw that thing I put on your desk of the choirs.
Yeah.
Is that something you want to do?
I have book club on.
Okay, that's a question, because if not, I'm gonna take a bus. So let me go downstairs and sign up for the bus.
Oh, what time is it?
3:30.
Now, I invite you to go ahead and bring your attention to your heart center. This space in the middle of your chest. Go ahead and sense your heartbeat. And remember that this is a rhythm that has carried you through every moment of your life. And you might imagine a warm glow, a warm light glowing right there. Soft and steady and alive. And this light represents your own inner source of meaning. What gives your life purpose or love and even connection. And go ahead, let this light expand. Gently filling your body and then radiating outward. And feel it connecting you to the people and to the communities and the things that support you. To the natural world, the trees, the sky, and the ocean. And to something larger, whatever you hold sacred, spirit, life, love, energy, perhaps it's God, the universe, or maybe it's simply just our breath right now. Rest in that connection for a few breaths and feel how you are part of something vast, living, and whole. Just take a few more breaths here on your own. Now slowly bring awareness back to your breath and back to your body, sitting here, right here in this moment. And I invite you to let let your hands, perhaps one or both, rest over your heart if that feels comfortable. And just ask yourself in this moment, what am I connected to? And what truly sustains me? And you might notice a word or image or a feeling that arises in you. And let that be a reminder that spirituality is not something that's far away. It's already within you, available anytime you pause and you remember. So as you're ready, I just ask you to bring your attention back to your room, back in your body. Wiggle your toes, feel your feet on the floor and the air on your skin. And feel free to gently open your eyes and just bringing with you the calm and all this connection that you've just cultivated. And I hope this sense of presence just continues to guide you through the rest of your day, and know that it's available for you to tune in at any time. Thank you.
And Michelle, so much. This was delightful. It's always wonderful to have you, and actually it's kind of great fit into what's going to be next week and the week after. Just a reminder, Eliza will continue with the topic of spirituality, and I personally feel like I tend to draw some of my most important inspiration and grounding from this topic. So thank you again. I'm reposting the NAS registration if you'd like to attend. Janet already posted what we have next week. Linda, I copied and saved your message to me. Thank you for Rudolf Steiner's comment. That was very timely. So everybody enjoy this magnificent weather. Who knows how long it's going to last, but I definitely will spend some time outdoors today. I don't know. Somehow we missed that whole hurricane that came to the New Jersey and New York. We didn't get much at all. So, and I encourage you to stay if you have questions. Otherwise, we'll see everybody next Friday, and have a wonderful weekend.